Welcome back to another MedRevisions video. So today we'll be discussing a topic that was tested in the May 2021 PLAB 1 exam. And we'll also give you some helpful tips for the upcoming exams, and hopefully that will bring you one step closer to passing the PLAB 1 exam. Okay, let's dive right into the video. Now before we discuss the question, please take 50 seconds to pause the video and comment the answer down below. Okay, so let's get to the question now. We have a 76-year-old man who developed acute urinary retention while traveling on a train. His past medical history includes hypertension, for which he takes amlodipine and bisoprolol for 5 years. He has been having nocturnal urinary frequency for 2 years. What is the most likely cause of his urinary retention? Okay, so the correct answer here is BPH, or benign prostatic hypertrophy. Before we discuss why that option is the correct answer and other options, don't forget to smash that like button. It wouldn't even take a second. And also, comment down below on any other topics you'd like us to cover in the upcoming videos. And make sure you check out the reviews from our past PLAB 1 candidates. The link is in the description below. So, as I said before, the correct answer is benign prostatic hypertrophy. So BPH is an enlargement of the prostate gland without any malignancy. Now, as men age, the prostate also enlarges, and that impinges on the bladder. Thus, it increases the need to urinate more frequently. And hypertension is one of the risk factors of developing BPH. So urinary retention is one of the severe complications where admission to the hospital is required immediately. Now this is likely due to bladder outlet obstruction. And also this may be precipitated by anticholinergic drugs, including tricyclic antidepressants, opiates, and diuretics. So why isn't constipation the correct answer? Now, constipation is common in the elderly, but it would not cause acute retention of urine and enlargement of the prostate. So why not prostate cancer? Prostate cancer is one of the important differentials that need to be ruled out when it comes to age and prostate enlargement. Now we can do a digital rectal exam and a biopsy that would confirm the diagnosis. Now for it to be a diagnosis of prostate cancer, there would also need to be some other systemic symptoms like loss of weight, loss of appetite, tiredness, and lymphadenopathy. So that is not the correct answer here. Why not renal stones? Now many stones are asymptomatic and they are discovered during investigations. Although urinary retention can be caused by renal stones, other symptoms associated would have to be there, like hematuria, nausea, vomiting, dysuria, rigors, and fever. And lastly, urinary tract infection. Now, infections in the urinary tract, or UTIs, are common in BPH because of urine retention and prostate enlargement. The patient does not present with any common symptoms like fever, dysuria, cloudy urine, and nausea and vomiting. Therefore, benign prostatic hyperplasia is the most likely diagnosis here. Okay, so I hope that was clear for all of you. And remember, we have so many questions like this in our MedRevisions platform, so check them out. And the other options that are mentioned in this question are also high yield, so make sure you check out those concepts as well and make yourself familiar. Okay? That's it for this video. Thanks for watching. This video was brought to you by MedRevisions, your go-to resource for PLAB Part 1. Complete your revision with MedRevisions.